Do you need exercises for a pinched nerve in your neck? Whether you've just woken up with a stiff neck or whether you've had a pinched nerve for a long time, if you've got a pinched nerve in your neck and you'd like some help for it, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain a couple of things that can cause symptoms of a pinched nerve in the neck, how to know if you actually have a pinched nerve in the neck, and some exercises that you can do to relieve your neck pain regardless of which of the problems is causing it. Now, if you find this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. So first of all, what are the symptoms of a pinched nerve in the neck? Well, if you truly have a pinched nerve in the neck, it will cause pain that refers down into your shoulder or possibly down into your arm, all the way down into the hand in some cases. And if you just woke up with a stiff neck and you feel like I can't turn it, but the pain is just really pretty local, it may be sharp, it may be pretty intense, but chances are that you may actually not have a pinched nerve in the neck. Now, regardless of which one of those problems it is, I will show you some exercises that can help either of them. Now, there's a third classification of symptoms where you actually do have symptoms in your arm or in your shoulder, but it may actually not be from a pinched nerve. It may actually be from a pulled or overstretched nerve. So how do you know which one you actually have and which exercises are best in each of those cases? So let's go to the most common thing that people describe of as a pinched nerve in their neck. And that's usually the thing that isn't actually a pinched nerve. When you wake up early in the morning, you maybe slept with your head in a funny position. You think you just slept wrong. But did you really sleep that much differently than any other night? And in most cases, you really didn't. It's just a matter of cumulative microtrauma over time. Abnormal positions of your head and neck at nighttime, during the daytime, where there's some muscle imbalances that build up and things get stiff. And then suddenly one morning you wake up and you've got this kink in your neck that you just feel like you can't move your head very well. And if that's the case, if that's what you're feeling, in most cases it's actually a joint problem. The muscles have gotten stiff from maybe your head being too low on the pillow, not having enough neck support to take up that entire space between your head and your neck. And if that is the case, I would recommend getting a pillow that supports your entire head all the way out to here. So not so thick that it's pushing you up away from the shoulder, but also not so thin that you're draping over and making the muscles on this side of the neck stiff. When that happens, it can compress the joints in the neck together, and you've got little joints in the neck that aren't present in any other part of your spine. They're called uncovertebral joints. And what those are, they're little lips that run along the side of the vertebrae. And when they get stuck, it gives you trouble, particularly with side bending movements, but also can limit your rotation as well. So if you're having stiffness in your neck and you get these sharp pains when you go to turn your head in the morning, a lot of times it is because of stiff muscles and a stiff joint, particularly if you're not getting symptoms that radiate down into your shoulder and your shoulder blade and your arm. So if that's the case, here are some exercises to help out with that problem. Those little lips on the side, when you go towards that side, they tend to get irritated. And so the thing that you want to do is actually not try to force it and go further into the direction that you can't turn, but you actually want to go the opposite direction, stretching out the scalene muscles and the other muscles in your neck on that side, stretching out the uncovertebral joints that I mentioned a little bit earlier. Those things can help kind of loosen up the joints in your neck so you can turn your neck more comfortably. It's kind of like if you have a sock drawer that's stuck and you can't push the sock drawer in, and if you just keep jamming it in, you're not going to get it in any further. But if you slide it back out and then kind of finesse it back in on the right track, then that a lot of times is a lot more effective. And that's the same strategy that you use if you have a joint problem when you've woken up in the morning and you have a stiff neck. Now, second, what about an actual pinched nerve in the neck? And in that case, you have a narrowing where the nerve comes out, and it actually puts pressure on the nerve to the point where it's causing either pain, numbness, or tingling to go down into your arm, or it may be causing some weakness in your arm or hand. in really severe or chronic cases. Maybe you notice that you're dropping things a little bit more regularly. You might even feel like you have carpal tunnel syndrome, but maybe you had a test for it and an EMG or nerve conduction test found that you don't actually have carpal tunnel syndrome. Well, if you have any of those things, you may have a true pinched nerve in your neck. That can come from degenerative discs in your neck where the openings where the nerves come out become a little bit more narrow. And if that's the case, I've got other videos that tell you about some different things that you can do for degenerative discs in your neck. But in any event, if you've got a pinched nerve, the space where the nerve comes out has become more narrow, and you need to find ways to open it up. Now, very similar to that last exercise that I showed, if you have a narrow joint space on this side of your neck, then you need to open up the joint space on that side of the neck. So the things that open up the joint space on this side of the neck are looking downwards. That actually opens them up on both sides of the neck. Tipping your head away from the sore side or turning your head away from the sore side. And if you do combinations of any of those where you look down and turn, or you look down and tip, or all three, that kind of opens the spaces up where your nerves come out. Now, when you turn to the side that's painful, that narrows the nerves. So maybe you have trouble looking over your shoulder to check your mirror when you're driving your car, or if someone calls your name and you turn your neck really quickly, you get pain. Well, if you're doing a motion where you turn to that side and you're also kind of extending, looking back like that at the same time, then that's going to pinch the nerves in your neck. If you can train yourself to keep your chin down, to sit with a little better posture rather than having your head out like this, to keep your chin and your chin tucked and head above your shoulders, that opens up the spaces all day long where your nerves come out and helps make things, helps put a little less pressure on the nerves. But when you are turning, if you can train yourself to keep your chin down when you're turning and turn chin to shoulder, chin to shoulder, chin to shoulder, instead of chin over your shoulder, that will help you to be able to turn more comfortably. Now, what's the third case that I mentioned? Well, in some cases, you can have symptoms of a pinched nerve where you actually do feel symptoms into your shoulder or into your arm, but it may actually not be from the nerve being pinched. It may be that that nerve has gotten overstretched. Things that can cause that are like a whiplash injury if your head gets pulled away from that side and you get an overstretching of the nerve, or like getting hit in a sports injury like a stinger in football where you hit someone with your shoulder and the neck goes to the opposite side. Anywhere where the neck gets overstretched, that can cause that type of an injury. You can also get it slowly over time if your shoulder blade on one side sits a little bit lower than the shoulder blade on the other side. And in that case, it's usually not an acute injury, but it's something that builds up gradually over time. And again, you may wake up one morning and feel like you've got a stiff neck, but it may not have been something that happened necessarily that last night. It's just a cumulative effect until sort of the straw broke the camel's back, or neck in this case. So what do you do if you have a pulled or overstretched nerve that's causing symptoms of a pinched nerve down your arm? Well, in that case, you actually don't want to go away from the problem, because if you further overstretch the nerve that's already sore because it's been overstretched in the first place, it just makes it more irritable. So in that case, you want to keep your arms supported, make sure you use your armrests in your chairs, make sure that you don't carry heavy things in the side that is symptomatic, because those things just further depress your shoulder blade and further overstretch the neck. So you want to make sure that you get good arm support. Actually doing exercises where you reach your arms up overhead and try to shorten the muscles in your neck can be helpful if you have a pulled or overstretched nerve in your neck as well. And I've got some other videos showing exercises for those type of problems, which I'll link to in the comments below or in the blog post, depending on where you're watching this. So just to review, the three types of injuries that you may have that mimic a pinched nerve are just a joint or muscle problem where you wake up with a stiff neck, a actual pinched nerve where you have narrowing of the spaces where the nerves come out, oftentimes because of degenerative disc disease, or an overstretched traction injury to the nerve, in which case you don't want to stretch away from the problem. You actually want to shorten the muscle and take tension off the nerve. So hopefully you found something helpful in this video. If you did, leave a comment below as to what you learned. And if you did find this helpful, give it a like and thumbs up and subscribe to our channel so you can get notified of our future videos. If you happen to live in St. Louis and you need more help for your neck pain or to figure out which of the 3 types of problems that you actually have, feel free to contact us at More for Life. We'd be happy to help you out. But wherever you're listening from, I appreciate you taking the time to watch this video. Thanks so much and have a great day.